I'm happy to welcome you all here to this presentation about treating the family system throughout the young adult years. I'm Sarah Harte, the director of the dorm in Washington, D.C., and I'm joined by Gale Saler, who is with Newport Academy and the Arise Network. So we're going to spend just the next half an hour talking with you about these three learning objectives. We want you to help you become knowledgeable about the role of the family system in the therapeutic treatment and its improved outcomes. We want to understand best practices and treatment approaches that promote effective family involvement, especially during young adult years. And then, of course, leave you with some resources that support young adults in college and their families throughout the treatment journey. So without further ado, I will pass things over to Gale Saler to get us started.
Hi, good morning. It's really nice to be here with you and with the dorm. I love the fact that we work so well with programs like the dorm. What I want to talk to you about this morning is the fact that without the family being actively involved in the treatment process, they are likely, and research has shown us that they are likely to unconsciously sabotage what is going on in terms of recovery. And that's recovery from substance use issues, mental health issues, medical issues, gambling, aging, name it. Family involvement is one of the most curative factors in working with folks who are experiencing difficulties in their life. And we need to understand that the process itself, and it is a process, not an event, starts from the very first call. Frequently, they may come from a colleague or a treatment center, but frequently it's a family member who calls and they're in crisis. And we need to almost immediately stop them. They are going to want to talk to us, and they have someone that they can talk about everything that's been going on and all of their angst and all of their concern. What we want to do is stop them briefly and change that focus just a teeny bit and say to them something like, wow, I really hear that you are going through all of this. How are you doing? How are you doing? We want them to engage from the first moment. And they will frequently then take a deep breath, you'll find, and begin to talk about the impact on them and other members of the family. We can begin this at any point when a person of concern is not engaged, when they're already in treatment, when they're threatening to leave treatment. And sometimes treatment centers will refer a family when someone is about to discharge and they really feel that the family work has not been done. The basic principles we work with are being sensitive to issues of culture, gender, spirituality. We need to look at and expose and help resolve what appear to be or the family believes are family secrets. Frequently, they are not really secrets. We need to consider mental and physical health problems. We need to consider everything that's going on in the life of this family. And in a minute, I'll talk about the transitional pathway. But we want to assure the continuity of the family's values, missions, and heritage. The transitional pathway is this simple graph, and yet it's so profound. And it's something that I frequently draw for families when I'm working with them. Basically, it is a transitional pathway is our experiences, how we're experiencing life. So it's the past, it's the present, it's the future. It may be, in the case of folks that call us, taking them from despair to relief and resolution and to hope. And can you go back one sec? One of the things that's really important to understand about this is research shows us that if we are going through, if an individual is going through 3 or more transitions at any one time, someone in the family system is likely to become symptomatic. They're likely to become symptomatic because every transition, whether it's a positive transition like a promotion or a negative transition like an overdose. All of those come with tasks. So for every transition, there may be 3 or 4 or 5 or 10 tasks that we have to take on, and it becomes overwhelming. So those transitions and working with the family and helping them understand that is really important. When in the ARISE system, we really start with comprehensive care. Invitational intervention is something that is part of the system, but frequently, we go from the first, if you go down the main tower here, we start with the first call, we have a family meeting, we go to comprehensive care family meetings and continue that. Frequently, just from the first or second family meeting, an individual that they called about will agree to get help, and other members of the family will ask for help. If that's not the case, then we can go to what we call a level 2 meeting, which would be bringing in more people to surround this person with love and attention and focusing on the resilience of the family. Rarely do we get to what most people think of as an intervention, and never do we surprise a person. Everyone is always aware of what's going on. They call us about an individual, they are informed by us. There is no secret. Even if we go to an intervention, they are told it is going to happen. So there are no surprises and nothing is done behind a person's back, which has a major influence on getting people into treatment. Our goals are really to build the family relationships, resolve issues, and making appropriate referrals, not just for the person they called about. In most cases, multiple members of the family will ask for assistance, either assistance in what they can do to support the individual and or to deal with the issues that they've been having on themselves. Sometimes anxiety, depression, any of the types of things that might come along with a family being in crisis. We consider whether and when an invitational intervention might be needed. Again, actual intervention, if you work the family system, is secondary. We do family psychoeducation regarding addiction, behavioral health issues, mental health, especially if they're not participating in a treatment center's family program. We provide strong encouragement for everyone to maybe attend 12-step meetings or other relevant support groups, if a cancer support group or whatever. And we work on life skills building for the individual and the family. One of the things I always like to point to the data. This study was done on the rates of engagement, treatment engagement over 6 months. And you'll notice that CRAFT and ARISE have the best, were shown to have the best engagement rates. Interestingly, Al-Anon, which is not even considered an approach to get someone in treatment, actually, and just by itself has a 13% engagement rate. Unilateral family therapy approaches, 39%, Johnson model, 25 to 30%, but CRAFT, which is a psychoeducational method and is evidence-based, and ARISE, which is a comprehensive family systems approach with invitational intervention, and also an evidence-based practice, have the best rates. So our evidence-based models do the best. One of the primary things we have to do, as I said, they call us about a person and we're looking at the family. How much is the family willing to lose waiting for rock bottom? I don't believe anyone has to hit rock bottom. Are they willing to risk death? We want to redefine success. So frequently, a family will look at their family story and see it as a story of vulnerability, multiple generations of drug problems, alcohol problems, mental health problems. What we want to do is help them turn that switch and look at it as a story of resilience. The family needs to focus on hope and healing for everyone, not just on the using or the changing problems of one individual. How do we do that? So here's a picture of the family as we usually see it when we're first called. They're calling us about a particular person of concern, which is the POC in the middle, but they're looking at it as if the POC is their addiction. The POC equals addiction, and the focus is solely on what is going on with that person, what is happening, why they need help, and everyone is focused inward on them. What happens if we change that just the first little bit? So if we say to them, you know, this POC is just another part of the family. Let's look. So now we're all looking at the addiction that has involved this person, or the mental health problem, or the medical problem. And we begin to look at, you know, what is going on here and why are we dealing with, and we're all focused on this addiction and how it's impacting our family. But that step needs to go, we need to go that next step, which is to say, the addiction is one thing that is going on in this family. So now we've taken the addiction and we've put it over by the person that they called us about, the person of concern. And we say, okay, so now what are we looking at? We're looking at the family. We're looking at each other. What is going on in the family system, and how are we all impacted by that? So now as we begin that family meeting and that discussion, we talk about that the brother has some unresolved grief, possibly using an example, he and his wife had a miscarriage and they're still grieving that recently. Mom got a couple of DUIs and grandma's health is ailing. And of course we have the original addiction we got called about. So there are a number of things going on in the family system that everyone is dealing with in isolation, but not using the strength of the family. What we want to begin to work with them in our comprehensive care meetings with is to get them to looking at a healthy relationship. What is a healthy relationship look like? We can move that one. Nope, back one. Back one. Okay, so now we've got a family system where we're talking. We've got the family talking about all the issues that are going on and how we can support each other. Once the family begins talking this way, it becomes easier to work with the original problems and those other problems. So we see that now a number of people in the family system are going to focus and help mom, who is the only one dealing with grandma's ailing health, are going to help with that. And, you know, dad is looking at helping mom with her DUIs, and, you know, they're looking at the other son who has some unresolved grief issues. And everything begins to start making sense. So what we're doing here is really taking away the shame, the blame, and the guilt. And once we do that, it becomes easy to do a warm, get the family to agree to get help. So the next step then becomes doing a warm handoff, collaborating. So in the case of the family member who has the addiction or the drug misuse problem, I would now guide the family perhaps to talking to the dorm and beginning to work with the dorm or with Newport Academy. And with that, I'm going to hand it over to Sarah, who's going to talk about what happens when that handoff happens.
Thank you, Gale. That's just such a cool image when you think about you know, the whole family system, and that it's not just one person. And that's kind of how we think about this handoff, that it's not just a handoff, it's a collaboration. So, in talking about all of the things that collaborative care and the Arise network can help us with, then being able to get somebody primed and a whole family system primed for treatment is a real gift to us. You can go ahead. So, when we're thinking about this collaboration, what we want to do is really highlight a few components. Of course, communication is going to be key, that the program will benefit from the understanding of the process of what the family has been through, in that exact example that Gale talked about. But we also want to understand what the person of concern has been going through as well. Obviously, they're coming in as our client, but we don't see them as just a sole person. We are going to be working with the whole family system as well. So knowing this background information really helps therapists tailor the initial treatment experience so that it can address the most urgent concerns of the person of concern, but also start speaking to some of these larger family system issues. And we know that family involvement is just crucial. A lot of young adults think, I'm over 18, I can do this as an adult. And we say, yes, you are over 18, you are an adult, but adulthood does not mean that you are no longer part of a family. So we really require family involvement and integration into the system throughout treatment, not just at the beginning. Part of what we can do with the help of the folks at Arise or other folks who are working with a family system at the same time as us working with the person of concern and their family is doing some expectation management. So understanding everybody, helping everybody understand how they're going to be involved in the treatment and managing those expectations, both for the near term and long term. So having some foundational conversations about expected length of stay, expectations about what is our role in the treatment team, and what is the role of all of the other folks who are involved with the family. If there are outside therapists that are involved, the continuing collaboration and coordinated care through Arise. Maybe there's a family therapist involved, other folks like, of course, educational consultants. So really having active conversations with the whole team to say, where does your role end and begin, and where does my role end and begin? So really partnering and keeping that communication clear, and working through some problem-solving strategies when natural challenges come up. We really want to know, who takes the lead when things get complicated. We know things always come up in treatment. Families are complicated. Who's going to be the point person for parents? Who's going to be point persons for siblings, the identified patient, all of that. So if we can think back to Gale's image with all of those arrows, who is in each corner of that family system to know who do they go to when things get complicated. One of the things that we know is that maintaining motivation to change happens throughout treatment. So all of the motivation that Gale was talking about that these family meetings create really help people become naturally motivated to enter into treatment. We know that they see the impact of their behaviors, and other people are understanding the experiences and challenges that the whole family system has. So it really, like Gale says, removes some of that shame and allows people to start making moves and making changes. Once you start changing one component of that family system, other components start to loosen up as well. At times, though, that motivation can be mostly on behalf of the family. I don't want my parents to suffer anymore. I know this has been hard for my sister. I know this is difficult for my aunt and uncle, whatever other family members involved. And so people do that for someone else. But what we know is that external motivation changes to internal motivation over time. And especially as people make progress, they start to say, okay, I understand why this feels good. I understand why this is helpful. So this actually is now not just benefiting the reduction of conflict or struggle in my family, but it's also helping me feel better too. So maintaining that motivation of change is something that we are responsible as treatment providers to do throughout their course of treatment. So the principles of motivational interviewing are really helpful during intervention or those initial family meetings to help people engage in treatment. But it's also really helpful to revisit some of those principles throughout treatment when things get complicated, because motivation naturally waxes and wanes with time. So we want to be able to use those principles to maintain motivation as well. So especially when roadblocks come up or challenges, it can create a regression or people sliding back. So to be able to re-engage with the client, the person of concern, but also with their family members who are involved in treatment, to continue to check back in about what are your reasons for change. Let's revisit some of those initial conversations. Let me remind you about some of the things that you're working on with Gale's team at Arise or with your parent coach. And so as we have those conversations, we believe and we know that every person is able to find their own internal reasons for change. So again, talking about roadblocks, I hope I don't sound too pessimistic, but it's realistic. Life is complicated. I say to clients all the time, even when you successfully complete treatment, that doesn't necessarily mean you're on easy street, right? We know unexpected things come up, new challenges present themselves. So we want to be prepared, knowing that this is a normal part of the process. So when there is a roadblock, we want to change strategies in response to any kind of resistance. So something that might have worked previously might not work when something new presents itself. We want to recognize that this is an understandable response to difficult stimulus. We understand behavior makes sense. So we know that people are behaving out of something that is a struggle for them. So we can work with that. It takes away the judgment and the shame, like Gale was saying, and we want to say this is something that is normal, but we can also reframe what's going on to create new momentum, to create new opportunities to change. One of the things that I'm actually really interested in is the righting reflex, which is something that is normal for all of us to do, which is arguing the opposite side of an argument. And so if I'm really trying to convince somebody of something, it's going to be natural for them to say, actually, there's another side of the coin, or what about this? And that can be really frustrating, but it also can be used to our advantage, where we can understand that it's going to happen naturally, and then maybe even start to speak to the other side, or let go of that power struggle and try and align ourselves on the side of the coin with the client. And of course, engaging the client in problem solving is really important, because they need to have a voice, because this is their life. They need to be in the driver's seat. Like I was saying, the client needs to take the lead in developing their life worth living. This is particularly important for young adults. This is their chance to start to identify, what are the pieces of my life that are working? What are the things that I want to make adjustments? What do I want to hold on to from my family of origin and my history with my family? And what are things that I might want to shift up? And in that process, I'm going to be able to feel like I'm in the driver's seat of my own life. And so I'm going to make goals that are meaningful to me. So, a lot of young adults haven't ever really been asked, what do you want to do? What do you want? They might have been going from, elementary school to middle school to high school to curating their applications to college and even getting their bachelor's degree without really even questioning, who am I? Like, what are my goals? So really taking a step to say, what is it that makes you engaged? What is it that you're interested in? What is realistic for you? What fits with your lifestyle and your identity? And then, of course, parent coaching and family therapy is just integral. We know that young adults need and deserve the support of their parents. Parenting a young adult is very different than parenting an adolescent. Parenting a young adult with struggles or in a family system that has struggles is also challenging. So in parent coaching, we're really looking to say, just like Gale said at the beginning, how are you? Parents often think that a parent coaching session starts, or it will be about an update about their child. We might do that for 5 minutes, and then we'll say, okay, how about you? How are you doing with all of this? What's working? What's not working? What are ways that we can help support you in being the best support to your young adult child? And then, of course, planning for long-term success. So I hope, and Gale and I want to convince you that the way to help young adults in particular set them up for long-term success is to not just identify that they have a problem that they need to change. It's about saying, you are part of a system, and we want to support your whole system so that the whole system is supported for long-term change. But we also want the young adult to feel like they have some autonomy and voice in their process. So we want to help them understand how that system works together. And we really want to support self-efficacy. That is the question of what works for you? What is your goal? Where do you see yourself? And we can help your family understand why that's important to you. We also really want to reinforce the client's individual responsibility as well as the family and the ability to succeed. I truly believe even families and clients or persons of concerns who have been through real doozies or really complicated situations can come out, and actually often do come out better in the end. So that's something that after all the years I've been in this field, people say, oh, it's such a tough job working with families and young adults in this situation, but actually it's a really beautiful job because you see success over and over and over again. And so that allows for me and our clinical team to really be able to cultivate hope and say, you know, we've seen this work for people. We know, especially when it's not just about, you know, the one person who needs to get their act together. We know that when we work with the whole family and the whole team and model that active collaboration and healthy system with boundaries and communication and accountability, that there's actually a ton of reasons to have a lot of hope about a family actually being healthier on the end than they were when they came to us. But maybe even before they, you know, in the last 5-10 years. Somebody said to me once, a healthy family system is a family system that continually changes and adapts with time. And that means a lot to me because I know in my own experience that, you know, we shift our roles as we age, as our family members age. And that's something that's going to happen with young adulthood as well. So we can help these family systems set themselves up for long-term success. And on that note, I want to say thank you. This has been the initial part of the presentation. We really look forward to a continued conversation following this presentation with Gale and I, and you all with some questions and answers. And IECA, I think, also is going to ask you all to make sure to fill out your evaluation for the session. And your next steps are to return to your IECA virtual conference and then click on the Q&A link, and you'll see Gale and I there. Thank you so much for your time and attention.